Today I'll be talking about how sleep changes with age, the typical aging process by Payton Ziebarth. Understanding the effect of age-related changes in sleep habits is crucial to staying healthy. Our erratic sleep habits are often attributed to the deterioration of our health that comes with advancing age. Several factors contribute to this, including natural brain aging, hormone level fluctuations, and individual variances in diet and exercise. In this presentation, we'll look at how old age affects sleep, what that means, and how we may use knowledge to assist the elderly in getting a better night's rest. Physiological changes that take place as we age. Aging is associated with several physiological changes that impact sleep. Most notably, there's a decline in total sleep time, slow-wave sleep, and rapid eye movement sleep. The amount of time a person spends sleeping is qualified by their total time of sleep, which is commonly expressed in hours. It is the sum of a person's time in various sleep phases. Adults should aim for between at least 7 to 9 hours of sleep every night. Slow-wave sleep is a stage of sleep characterized with electrical waves in the brain activity known as delta waves. It's known as the deepest stage of sleep and is believed to be the most important for restoring the body and the mind. REM sleep is characterized by an increased muscular activity of brainwave and eye movements. Studies have shown that individuals, as they age, they typically require less sleep than younger individuals, leading to shorter sleep times. Further, while young adults typically experience more profound extended periods of slow-wave sleep, this decreases with age. Studies have found that REM sleep is reduced in older individuals and is often fragmented of lower intensity compared to younger individuals. In addition to these changes in sleep quality, an increase in daytime napping is also standard amongst elderly individuals, leading to shorter sleep latency and more fragmented sleep. Impacts of the physiological changes that take place as we age. Cognitive effects can be seen in the elderly population due to changes in sleep patterns with aging. Sleep disturbances such as sleep apnea, restless leg syndrome, and insomnia are significantly more likely to affect seniors. Sleep satisfaction and quality tend to be lower in elderly individuals, with studies showing that they are 2 to 3 more times likely to experience insomnia than younger adults. Furthermore, poor sleep is linked to an increased risk for cognitive decline and neurodegenerative diseases, with sleep deprivation causing an increase to amyloid beta deposition within the brain. Ways in which age-related changes can be accelerated. Insomnia has been linked to several health problems such as fatigue, decreased cognitive functioning, increased risk for depression and anxiety, and weakened immune systems. Anxiety and depression are frequently experienced among elderly populations. This can cause increased restlessness, difficulty concentrating, remembering things, and feelings of worry or hopelessness. Alcohol and caffeine consumption is more frequent among the elderly and can induce hyperarousal. Alcohol can reduce the body's ability to produce melatonin naturally, and chronic caffeine consumption has been associated with longer sleep latency and increased wakefulness. Chronic medical diseases, including cardiovascular disease, arthritis, or breathing problems, are more prevalent in the elderly, and they might contribute to the greater arousal and worse sleep quality. A person with cardiovascular illness may increase their respiratory rate, heart rate, and blood pressure, all of which may add to an overall sensation of alertness and make it more difficult to fall asleep. It may be challenging to obtain a restful slumber if you suffer from arthritis, which causes pain and inflammation. When you have trouble breathing, you may wake up more often throughout the night, raising your arousal and making it harder to go back to sleep. Sedatives like benzodiazepines might make you sleepy, but they also risk disturbing your sleep cycles and waking you up often. The stimulating action of anti-anxiety medications like SSRIs may increase sleep latency and decrease sleep quality. Finally, antidepressants, especially tricyclic antidepressants, have been linked to a decrease in total sleep duration and increase of alertness and trouble beginning and sustaining sleep. Ways in which age-related changes can be slowed down. Good sleep hygiene entails maintaining a regular bedtime and waking time, avoiding stimulating activities like watching TV or working on the computer in the house before bed, and not napping during the day. This may also be helpful if underlying physiological issues are impacting your ability to get a good night's sleep. Cognitive behavioral therapy may be helpful. Increasing the effectiveness of stimulant control therapy is yet another method for bettering the quality of your night's rest. One way to combat sleeplessness is to eliminate potential triggers in the bedroom, reduce your alcohol and caffeine intake, and also exercising regularly. Medications like melatonin sedatives can help some people get a better night's rest. Secretion of melatonin, a hormone critical to maintaining the body's natural sleep-wake cycle, decreases with age. Melatonin supplements have been shown to help people get to sleep faster and stay asleep longer. The effects of aging and sleep quality can be mitigated by several lifestyle factors, including maintaining social relationships, participating in activities that promote physical and cognitive health, and regulating stress levels. Mental and emotional health can both benefit from engaging in mentally and physically stimulating pastimes. Finally, lowering cortisol levels and increasing relaxation through stress management can promote better sleep when trying to sleep better and delay the effects of aging on sleep. Eliminating as many potential sleep disruptions as possible in the bedroom is essential.